Hello and welcome to the Answers for Cancers podcast. I am your host, Anne-Marie Fay.
And I'm Michelle Matthews.
Together with some of Ireland's leading experts, we want to unravel what it truly means to have cancer.
From consultant diagnosis to treatment plans, from managing your symptoms to supports available, we have it covered. So whether you're a nurse working in oncology or have been personally affected by cancer, this podcast is for you. We are so lucky to be joined by two special guests on the podcast today, Monica Conway and Claire Kelly, to cover the topic of lymphadema after cancer. We have split this episode into two parts, so be sure to check them both out. These two incredible women have extensive experience helping people to recover after a cancer diagnosis and beyond. We first became aware of the amazing work that they do when we started following their Instagram pages, and their passion was immediately evident. They work tirelessly to provide care for those in need, and they understand some of the challenges lymphedema can cause, and they want to help improve people's lives and outcomes. We could do a whole podcast based on their experience and expertise alone, as they work, volunteer, chair and run workshops. Today they walk us through how to calculate our risk score, and we will discuss the cornerstones of lymphedema, including skincare, compression, exercise, risk reduction strategies, and we also discuss the psychological impact a diagnosis of lymphedema can cause and how to acknowledge and address this. Thank you so much, Claire and Monica, for the incredible work that they do.
So welcome back to the podcast. We have a new specialist joining us now to continue on our lymphedema podcast, who is a perfect partner to Monica. They're the dream team here. So we have Claire with us now, and we might just start with you telling us a little bit about yourself, Claire. And again, you're a person that we've been trying to connect with a long time, so we're very, very grateful to have you here, and we've already learned so much from you today. So we're very grateful. So you might just tell us a little bit about yourself and what you do.
Thanks, guys. So Claire Kelly is my name, and I am the owner of Pura Vida Physio. And my background is I'm a physiotherapist, and my clinical background today has been across a number of specialties. So I initially worked as a clinical researcher, and then went to work into the HSC in Ireland in the areas of neurological, musculoskeletal, orthopaedic care and primary care. And then I did additional advanced training in vestibular rehab. And I have also I'm such a nerd when it comes to the body. So I've done additional training. I'm a Pilates instructor in mat, small equipment, reformer, bar, which would be Pilates and ballet. And I'm a yin and vinyasa yoga instructor. And then I also have a keen interest in ergonomics, so posture and looking at making your workplace safer. And then I've also done additional training because I specialised in cancer rehabilitation, a specialist area of physio, and I was conscious that the patients I was seeing are very vulnerable, so I did additional training in mindfulness-based stress reduction, mindful self-compassion and trauma-sensitive mindfulness. And then I'm also an activator poles instructor, and I'm an Otago Falls leader as well. So they are my areas of interest. Fully acknowledged, total nerd. And then I have a passion for education, something that is deeply important to me, and making it as accessible as possible.
Yeah, I think that's so obvious even from your Instagram. I will definitely share the link to it as well. I think you put up some really important videos and just simple diagrams that people can follow, and it's so educational. And I think you're one of the first accounts that we started following when we initially set up ours, and anyone who follows us will know we reshare a lot of your stuff because it's just brilliant. So thanks for being such an advocate for people, and that's so clear in all the experience that you've done as well.
Thank you.
What we might do is just quickly recap on some of the subclinical signs of lymphedema, if that's okay.
Yeah, I'd be delighted to. I like to explain this in different ways so that it lands with people a little bit easier. So what I would suggest is, you've been listening to the podcast for a little while now, so why don't you plant your feet firmly on the floor and sit up nice and straight wherever you are right now. Bring both of your arms out in front of you so that your elbows are straight and your palms are facing upwards. So both of the arms are going to start in a straight position, and I'd like you to keep your whichever arm one straight, and we're going to bend and straighten the opposite arm. Okay? And I want you to keep bending and straightening that arm, and just notice which arm gets tired first, and what do you notice first. So just be curious here. Okay, there's no right or wrong. What you're going to tell me is, what are you experiencing in the arm that stays still, that is not moving? What do you feel?
I think I'll jump in just to help people at home if they're listening, but it's weird. I would have thought the one that I was moving was going to feel more tired, but actually the one that's staying straight feels much heavier.
Yeah. What else do you notice?
It's naturally just going down.
Yeah.
It's getting tired. So I have to really focus to try and keep it elevated and up as high as it was initially when I started.
Brilliant. And if I asked you to stay there for another hour,
yeah,
what would you tell me?
I'd tell you to good luck. I'm off.
Brilliant. Yeah. So I sometimes use that as a way to explain to people that I work with the subclinical signs. So this is the stage 0 that Monica describes so beautifully. This is the stage that we want to really educate and empower people about, because this is the stage where it is not a formal diagnosis of lymphedema. Yes, there's signs of pressure on the lymphatic system, but we actually can reverse it at this stage. And that's an important message to get across. Okay. From my point of view, in terms of subclinical signs, exactly like you described there, you just noticed after a little while that it was feeling this, and for some people it can feel like the tingling that Monica mentioned, a sense of heaviness. It's basically an indication that your lymphatic system is starting to come under a bit of pressure. So it's telling you, you know what, I'm under pressure here. Okay. And for me, because I've always liked to look at the body from a whole systems point of view, and because that's the way I've studied it, I often look at it in terms of capacity versus load. So what I'm looking at is, if I know that my lymphatic system and my blood system, so another my vascular system, if they're best mates and they support each other, and that's what they do, if I have an issue with one, then I'm going to put pressure on the other, because they're trying to work together as a team. Yeah. But I think wider than that. And I would be thinking, okay, so I know how they're related, but what if there's a pressure in terms of, because my lymphatic system is part of my immune system and it's removing toxins, what if there's an issue in terms of my kidneys? What if there's an issue in terms of my heart health? What if there's an issue in terms of my lungs? What if my skin is an issue and was and has been? And what if there's an issue with my brain, which is the main processor, the main computer? So when I look at a client in front of me, I'm looking at each system and seeing, what's this person's capacity and what is the load on each of these systems currently? And that's how I view it.
And you mentioned there, that's all really, really insightful. So thanks so much for giving us even the demonstration there. It actually made a lot of sense even in my head to understand it a little bit more. And you mentioned the cohort of people there that, you know, that's really important to educate when they're at that stage 0, as you were mentioning there. Sometimes we hear about risk scores and who's at risk and who's higher risk and lower risk. Can you explain what a risk score is in terms of lymphedema?
I'd be delighted to. And I think that this is such an important message to get across, because this empowers people that are listening to be able to not just advocate for themselves, but for their loved ones. So if you know someone who has either gotten a diagnosis of cancer. So I want to acknowledge, first of all, my bias is secondary lymphedema. That's what I've studied. But I'm so interested in primary lymphedema and how we can support that cohort too. But in terms of when I look at risk score, what I'm looking at there is this is an exercise people can join us with. So what I'd like people that are listening to this, and first thing to acknowledge, everyone listening to this has a lymphatic system. So this is relevant to everyone. Okay. So I'm going to get you to get a piece of paper, and I'd like you to give yourself 1 point for each of the items mentioned here. Okay. So 1 point for each mentioned. So the first one is if you have had some lymph nodes removed. That's 1 point. The next is if your body mass index or your BMI is over 30. That's another point. The next is if you had infection or removal of excess fluid after your surgery. And that's sometimes known after cancer treatment as a seroma. That's 1 point. As Monica alluded to, if you had radiation therapy, that's another point. If you're exercising for less than twice a week before your diagnosis, that's another point. And if you've had chemotherapy, that's another point. So take some time to figure out, well, what's your risk score? And then I also want you to be aware that if you have had all of your lymph nodes removed in either the area of your groin in the area of your armpit, if you had a sentinel node biopsy, or if you've had lymph nodes removed in and around the area of the head and neck, that automatically puts you into a high risk category.
Mm-hmm.
Okay. So if you've calculated your score now, we're going to talk through that. So a score of 1 to 2 would be considered low risk. A score of 3 to 4 would be considered a medium risk of the development of lymphedema. And a score of 5 to 6 would be considered high risk. Okay? As Monica has mentioned, it is important to be mindful. We see clients that have a low risk that develop lymphedema, and we see high risk clients that never develop it. Okay? So although this document is incredibly important and it really empowers people to be aware of their risk, it is important to realize they do not necessarily match who goes on to develop this. Okay, so we just want to make that clear. And that document is a document that was developed by the HSC. It's available on their website, and we'll give you the link to that, and would have been peer reviewed then by the NCCP, Irish Cancer Society, and the NLFI.
Brilliant. And sorry, I might have heard that wrong, but even if you've had a sentinel lymph node biopsy, that puts you at high risk, does it?
So no, that would be one
apologies.
point.
Sorry.
Full auxiliary clearance is automatically high risk.
Perfect.
Full
Excuse me.
auxiliary.
Sorry.
Yeah.
Perfect. And we touched earlier on just about the 4 cornerstones of lymphedema. Can we recap on them quickly, if that's okay? And just touch.
Of course.
Yeah.
So
thank you.
One thing I want to put the point across on, because it's something that often comes up in clinic as where there's some confusion. It's important to remember, for the full management of this, all 4 cornerstones of care are essential. All 4. I can't miss one. Okay. So to recap on them, the first one is our skin care. We're protecting your barrier to prevent infection, because we know your lymphatic system is part of your immune system. So we want to avoid putting any additional pressure on your immune system. Okay, really important. So that's skin care. The second, it relates to manual lymphatic drainage. And Monica has mentioned about simple lymphatic drainage, which is a massage technique that people can do themselves every day to support their lymphatic system. The third area is compression, and as Monica mentioned, that needs to be formally assessed by a registered therapist. You can find details of registered therapists on the MLD Ireland website or through the NLFI website as well. Important that they are registered for your safety. And then the final area, which is my passion area, exercise. Yeah. And can I say, let's say movement, because exercise can often scare and be a barrier.
Yes, absolutely. Yeah.
And we know how amazing you are and how knowledgeable you are in the area of exercise. So we're going to have a whole dedicated podcast to that. But today, obviously, we're just touching on lymphedema. But yeah, we're really looking forward to that one as well.
So am I.
Brilliant. And then, and with the area of movement then, is there like a specific amount of time or anything that people should be moving a day, a week, or what in your experience could help?
So what I would say is I always look at this from, where is this person's start point?
Yeah.
So what I'm coming back to here is the idea of that capacity load. Okay. So what I want to highlight here is, if I have a stage 0 subclinical risk client in front of me, they're my favorite people to see. Okay. I can empower them to have strategies in place to find something they love doing that gets them moving, and for that to become a lifelong habit for them. Because that's the key here. We know that this lymphatic system that has either been born with a deficit or has developed one because of trauma, or can go on to get pressure on it if my heart gets affected, if my kidneys get affected, if my skin gets affected with cellulitis recurrently, or if my brain has an issue, or if my lungs have an issue. Yeah. So capacity versus load, what I want to look at then is the 2 key areas that need to be addressed are aerobic exercise and strength exercise, and you need both. Okay? Yeah. For those that are listening to this that are secondary lymphedema or at risk of secondary lymphedema, there are 2 separate recommendations, and we'll be going through this in more detail in a separate podcast. But as a general rule of thumb, if you are someone who is currently undergoing active treatment for cancer, the recommendation from the guidelines is that you're getting 90 minutes of aerobic exercise per week, which can be broken down into much, much smaller amounts. Okay? If you are someone who has finished active cancer treatment, you're still on hormone therapy, or you're a cancer survivor 10, 15 years down the line, the recommendation is that you're getting 150 minutes of moderate intensity exercise per week. And the key word there is moderate intensity. And I like to talk in terms of, there's very specific ways we can look at that if we've got someone who's very high risk. But a really simple analogy is this. If you can sing while you're doing aerobic exercise, you're going way too easy on yourself. Okay? You want to be able to talk while you are aerobically exercising. And it should feel somewhat hard. You should be starting to sweat a little bit, noticing your breathing's getting a little bit heavier, and you're starting to feel a bit warm. They're all good indications. There are more specific measures that I'll use with high-risk clients to keep them safer. But that's a really good reference point to use. And we'll sometimes use the Borg scale as well. The second then, so that's our aerobic. The last thing I want you to mention is if you are gasping, you're going too hard. Okay? And it's important to acknowledge that because we wanted to avoid stress on your body. Okay? So if I'm noticing gasping, that's your body saying, yeah, could you stop for a second and give me some water and take a breather? Because that's a bit too much for me. Okay? Important to know that. So that's the aerobic side. And then the strength side of things, regardless of whether you're primary or secondary, regardless of the stage of your cancer, the age, the gender, doesn't matter. The recommendations are the same. We need a minimum of 2 days of strength training per week, minimum, all through treatment. Okay? And this applies, and it's really important to get this message out there to our stage 4 clients.
So important to talk about this.
Okay? And the reason being is that movement is medicine. We have bodies of research showing us this now. And the other thing we want to think about is we need to start reframing this in the context of a muscle mindset. And I want to shout out to a colleague of mine, Helen Bealey in Australia. Hero, follow her account. Muscle mindset is crucial here because it will help you in terms of that capacity load. So if I'm a young woman and I've got 3 kids and I have to lift them regularly because they require that from me, they need that, I have to mind them, and I may not have other people to support me to do that, then I need to support that person to have the capacity to be able to do that. And for that limb to be functional enough to be able to manage that load. That's essential. Which means I need to build muscle. I need to build it. So I would always recommend, regardless of primary or secondary, we need to get in there early and get a muscle mindset going. We need to assist and support in finding things they love doing that will keep their muscle mass as a source of energy for them, but also as a way to be able to help in terms of the management of lymphedema as a condition.
And in terms of like, we know how important movement is, but I suppose in order to get to the point of movement, our overall well-being is really important.
100%.
And you used a really good analogy earlier on. I think it's called SMILE. Is that right? In terms of like how we can really look after ourselves and I suppose support us moving daily. Can you tell us a little bit about that? And
I'd love to. I'm a big fan of an analogy. Anything that's easy to remember. I'll bring it down to one question and I say it to every client that comes through the door to me. Well, it's technically 2. I say, what does your body need today? What does your body need today? And then I'll use SMILE. Okay? So S is for sleep. Have I scheduled rest for myself? Very important during active treatment. And have I prioritized my sleep today? That's S. M, have I moved enough today? Sometimes that's difficult. Sometimes I might be in meetings, I might be traveling somewhere, it might be difficult, but have I moved enough today? That's M. I, back to the breath, inhale, exhale. And when I say I way prefer exhale, inhale. Okay, belly breath, exactly like Monica mentioned, the importance of emptying the reservoir. And it has a physiological effect on the body because that's us stimulating your vagus nerve. That sends a powerful message to your body, you're safe. How important is that for someone who is undergoing cancer treatment and the uncertainty that is present in that process? That's I. So back to your breath. Okay, we're going to go into that in more detail in another podcast, but back to your breath, and you'll find those resources on the NLFI as well. L, Have you let people help you?
So important.
Massive one.
Yeah.
Tough one. And then also on L, have I connected with someone today? The importance of connection. And E, eat, one of my favorite topics. have I eaten and have I drank enough water and protein to nourish myself today? How many of us are skipping lunch, skipping breakfast because we're busy minding the other people around us?
Yeah,
so
absolutely.
Okay,
Yeah.
so smile, come back to what does your body need today, and then I would also ask, what does my mind need today? That's a very important question for people living with the risk of lymphedema or living with a diagnosis of it. It's a challenging diagnosis.
Yeah.
Comes with a lot of fears.
It does.
Claire, thanks so much for touching off, I suppose, the overall well-being, because it's so important when it comes to, I suppose, looking after anything that's going on in our bodies. But we might circle back to lymphedema in general and maybe just touch off a lymphedema flare-up.
Yes.
And what that looks like and what we can do.
Yeah. So a lymphedema flare-up may be experienced in the following symptoms. You might feel really extreme fatigue, feel exhausted. Because remember, it's part of your immune system. And if it's overloaded, then it means it is trying to move all these toxins for you. And if it's having difficulty with the capacity of that and there's a very high load on it, you're going to feel really tired.
Yeah.
Exhausting.
Is that because your body's just working overtime?
Yeah. And then the other thing I would say on that is fatigue's such a complex area.
Yeah.
Okay. It has other components to it as well, which we're actually going to touch on as well. So the other thing to be mindful of is that can bring with it all these thoughts of, oh my God, I'm so exhausted. Is this ever going to stop?
Yeah.
Which can bring you into a cycle of anxiety, of racing thoughts, which for your brain is exhausting. It can lend itself to low mood, so a depressive episode, which suddenly your motivation's gone through the floor and all of the things that could nourish you have been ditched because you just feel so low. So understandable. That then can have a knock-on effect on social withdrawal. So you stop connecting with the people that actually nourish you. And that makes you feel isolated and alone. It also can give a feeling of shame. So I've been given this diagnosis and I'm ashamed of it. And I'm finding it really difficult to accept this new body of mine. I don't want to accept it. I'm angry about it. I'm grieving the loss of what it was like before. You're going through essentially the stages of grief, which sometimes is denial. It sometimes shows up in clinic as depression and sadness, so understandable. Sometimes as anger and frustration. Completely on all valid emotions. And sometimes presents as an acceptance. Actually, this is how it is. Difficult stage to get to. And often it's not linear. And because of my trauma training, what I'm conscious of is I know that if I meet someone who's in a trauma state and is also in a shame spiral, then I need to hold space for that person, be sensitive to that and say, I hear exactly where you are right now. I understand fully why you're there. There's space for that here. I acknowledge all of the emotions that are coming up for you. I can understand you're exhausted. I can see this swelling and inflammation and pain and skin tightness that may be affecting your sleep. This change in temperature, the anxiety, the depression, the severe infection, that cellulitis you're constantly battling. I can understand how you're worn out from it. And what I would offer them routinely in practice is to offer themselves self-compassion. And can I admit, first off, because it's challenging even as therapists to offer ourselves this on a day-to-day basis, because we want to be the person that will pour out a sense of tender compassion to the people we meet. But this is a game changer for people. So I'd like to offer one practice that may help someone who is currently dealing with any of those symptoms of the flare-up, okay? Or who's presently finding it difficult to come to terms with this as a risk or potential diagnosis. Because the important thing to remember is shame cannot continue. It loves silence. Can't continue when it is brought out into the open and said, you know what, you're not on your own with this. I feel that too. I've experienced that too. I find that hard too.
It nearly just dissolves the shame of it,
does,
doesn't it?
and that's essential.
Yeah.
Okay. And that's where I find I'm blessed and grateful for the people I get to work with, because I'm brought in contact with groups of people that get to share their experience and get to acknowledge, oh, that was really tough. I found that really hard. How did you find it? What worked for you? And can share that experience with each other. It ditches shame and brings people into a state of empowerment where they go, you know what? I actually see me wearing my compression now as a real loving sign to myself. That's me actively saying, yes, I've got lymphedema, but I am supporting my system today. Yeah. And if you're curious about that, I'll explain. I have a lymphatic system that's under pressure, and I want to support it today because that's what my body needs. And that suddenly opens the door for someone else who might be really scared about wearing theirs. They're like, oh my God, you're wearing yours. So that gives me permission to wear mine.
Yeah.
Powerful.
Yeah.
So we're going to go through a really quick soothing touch practice. And this, from a physiology point of view, this is you stimulating your vagus nerve to take you out of a trauma response and to bring you into your parasympathetic nervous system, your rest and digest, the state in which we know that healing occurs. To do that, you need to come out of a trauma response, which means you need to plant your feet on the floor and tell your body that it's safe. It does not need to run away. It can stay grounded in this moment. And this can be done in any position. This can be done in your own bed. It can be done sitting down. It can be done anywhere. It can be done when you're in a situation that you find triggering, waiting for results, in a hospital setting, in the middle of treatment, speaking to friends or family where it's triggering for you, anytime. And what you're going to do, and I'm going to offer you a few options here. Put your feet flat on the floor. And the option to either close your eyes or keep them open, just soften your gaze. And what you're going to do and recognize is your skin's a really sensitive organ. And our research shows us that a caring physical touch will release oxytocin, and that provides a sense of security to soothe these distressing emotions and to calm our heart. We calm our heart. That helps our lymphatic system. They're buddies. So I'm going to invite you to put your hand onto the back of your neck. And you can choose whichever hand, and if one gets uncomfortable, feel free to swap to the other. Let's just be curious here. When you notice that you're under stress, can you leave your hand in place here and invite yourself to take 2 to 3 slow breaths, either through the nose or the mouth, whichever is more comfortable for you. And what I want you to imagine is that this is the hand of someone who loves you dearly. And they are letting you know through this touch, you matter to me. I love you both tenderly and fiercely. I want you to be well, I want you to be safe, and I want you to know how much you matter to me, how much your health matters to me. I'm here for you. Even when you feel alone, I'm here for you. And just notice, how does your body respond to that touch? Can you feel your breath at your belly? And if the answer is no, let's try a different option. Let's offer the option of your hands in what's known as container arms. And I still want my feet flat on the floor, but I'm going to place my hands onto my arms, and I'm going to be curious, do I feel safer with my hands at my elbows, at my mid-arm or the top of my shoulders, which gives you the feeling of the greatest amount of safety? So explore. And once you've found a position that feels safe for you, again, the option to close your eyes to tap into what you feel here. And again, imagine these as the arms of your best friend. And they want you to know that you are held, that you are supported, and they are here for you in this difficult time. They can recognize the struggle, the problems that you're facing, and they want you to know that you are held in this period. Notice the sensations that come up in your body as you hear your best friend speak to you. Where is your breath in this container arm? How does your body respond to that loving kindness and understanding. And these are practices you can use at any stage when you need them, either as a therapist or as someone who is at risk of or who has a diagnosis of lymphedema. We can all use these as strategies. Final point, and as a yoga instructor, I want to acknowledge this in yin is associated with your heart meridian. So it's important that this actually is a triggering spot for some people because it's an area associated with grief and loss. So for some people, this may not be possible at certain stages. It might be too overwhelming for you, and that's okay. So know that if it is, you come back to the neck or you come back to your container arms, whichever of those helped you feel safest. And I want you to explore, does that skin to skin contact, your hand on heart, do you feel safest with one hand or both? And are your feet still flat on the floor? Where is your breath now? Is it at the top of your chest? Is it down at your belly? Where are you breathing to presently? And could you imagine that this is the hand of the person who loves you the most? And that can be living or dead. The person who has made you feel safest. And you're going to imagine that through this physical touch, that they have 3 wishes for you. They want you to be well. They want you to feel safe. And they want you to know that you are never alone. They are always there for you. Always will be. If that brings up a lot of distressing emotions, back to the neck, back to the arms. But 3 powerful self-compassion exercises that can be very helpful for those that are working through the difficulties associated with and the stress associated with a potential diagnosis of or a diagnosis of lymphedema, especially where there is anxiety, depression, or where there may have been an existing mental health issue. And we would also say, please ensure you're going to attend a professional for additional support. Yeah. Really important.
Claire, thank you so much. I'm thinking there, I know one of the biggest times of anxiety is for people waiting for scans or scan results or going into their consultant, and all of the things that you just said there can be done in a waiting room.
Yes.
And it's just a lovely thing to take away from today.
So one of the questions that comes up an awful lot in clinic for me is, am I allowed to lift? And how heavy can I lift? And with that, I want to come back again to the idea of capacity and load. So you need to be, if you are a high risk, I would be recommending that you seek specialist support from a Pink and Steel registered therapist. You'll find details of your local therapist, public and privately, on the NLFI website. I also want to direct people towards the PERCS website, PERCS, our colleagues in research who have done huge work to collate all of the exercise resources available to people affected by a cancer diagnosis in Ireland and their exercise options. The important message to get across and what the research is showing us here is there is no upper weight limit when it comes to strength training with lymphedema or for those at risk of lymphedema. But the guidelines show us that it needs to start low and slow. It needs to be done on a consistent basis, and it needs to be continued for life. 2 days a week for life. So my recommendation, find something that you love. So get curious. If you've never done it before, seek support to find what can I do that I will love and that I'll sustain and I'll continue. And we'll talk more about that in the next podcast.
That's brilliant. And I suppose just before you go, there was a couple of questions that came in through Instagram, and one was around the fear of lymphedema getting worse, and the fear that if it gets worse, it's going to inhibit their recovery emotionally and mentally from cancer. Is that something that you see in clinic?
It's probably the most reported fear that I hear in both educational talks and from the people that I work with on a day-to-day basis in clinic. So what I would like to get the point across here is we want you to know that we have collated all of the best evidence to help to support you, to support your systems, not just your lymphatic system, but all of them. And they are available through the NLFI website. You'll also find them on the HSE website, and we'll provide links to both. Generic information, what you want to empower yourself to know. There are leaflets available to you that will break down activity to reduce your risk of lymphedema, cellulitis and lymphedema and how to manage that appropriately, how to take care of your skin, travel and lymphedema, as Monica has mentioned, managing your weight, and what is cancer-related lymphedema. So you can educate yourself, even if you're someone who's just gotten a diagnosis or is awaiting results. You can empower yourself now. And then we have more body-specific handouts, ones that would relate to leg lymphedema, arm lymphedema, breast lymphedema, genital lymphedema, and head and neck lymphedema. They're collated into additional books that look at lower body lymphedema, so this would be leg and genital. We have upper body lymphedema, which would be arm and breast, and then head and neck lymphedema. And we want to make it clear for those that listen to the podcast here, if there's someone in your life that is going through a diagnosis of head and neck, breast, genital, gynecological or prostate cancers, you may be the person that advocates for them and signposts them to the resources that may reduce their risk. And the key message we want to get across is it's early detection and early treatment that improves outcomes. So we want to get in earlier to help people that would be at subclinical stage to reverse it, that they never have to worry about lymphedema. And we want to empower people that where their capacity is just systems under too much pressure, how do we support you with daily practices that prevent it from progressing from stage 1 through to stage 3? Okay. And what we would be recommending is we have collated all of that evidence and research to one website for you, the NLFI. Please go to it and you will find support videos that you can do on a daily basis to support your systems.
Guys, thank you both
Claire,
so much for all the work you do.
And Monica, thank you so much.
Thanks for listening to the Answers for Cancers podcast. Please share this podcast with anybody who you think it might help. Also, if you can like and subscribe, it lets people know we're here. You can alternatively contact us on Instagram at the Answers for Cancers _podcast. And if you've any questions on anything that we discussed today, please email us at the answersforcancerspodcast@gmail.com, or you can DM us on Instagram.